The neuroscience unit of Eden Medical Center is one of the best in the Bay Area. The doctors here are fortunate to have access to the newest technology available and are helping to bring relief to many patients with back pain. Chronic pain associated with either injury or spine-related disease is one of the most difficult things for a person to have to live with. But now, with new technologies and treatment, doctors like Eden Medical Center's Ronnie Mimran have the tools available to treat patients and return them back to a normal, pain-free life.
Typically, patients, prior to even considering any kind of surgery, are led through a variety of non-operative conservative measures. This could include things as simple as medications, anti-inflammatory medications. It can range towards physical therapy and chiropractics. As the problem becomes more severe and they become a little more refractory to conservative management, then we could try slightly more aggressive maneuvers like epidural steroid injections or facet blocks. And then depending on how a patient responds to these things, they kind of work their way through a channel, and sometimes the only thing left for them or the right thing to do for them winds up being surgery.
Like in the case of Mike Sexton.
I knew surgery was the only option, but I had to convince the doctor. But since they're professionals, I let them try their thing first. I'll try one thing, and so we tried pain management because I had some compressed nerves too. So they took care of that problem with pain management. They didn't take care of the disc problem. So that's when I went back to see him.
In that visit, Mike learned about the new advancements in minimally invasive surgery and a new tool used in the operating room called the O-arm.
So the O-arm is a brand new device that really was developed over the course of the last few years. It can be thought of as sort of a GPS for the spine. Surgeons use the O-arm as a tool, one of the other tools in our belt, so to speak, in the operating room for increasing safety and increasing efficacy in the operating room. Contrary to popular thought, minimally invasive spine surgery isn't an oxymoron. Many of the things that we've done in the past can now be done through smaller and smaller incisions, easier and easier methods. Our understanding of the spine has gotten better, and in doing so, our ability to deal with the problems in a more minimally invasive manner has become much easier. We can now get to the same parts of the spine through smaller and smaller incisions, using microscopic techniques, endoscopic techniques, using different tools, devices, instruments, retractors that previously were undiscovered and uninvented to accomplish the same exact goals and get patients good outcomes with much less tissue disruption.
After the surgery, the relief was immediate. Before surgery, my left leg below the knee was swollen. This one was normal, and I didn't know if it was because of the back or there's something else wrong. Well, when they had the surgery, next day my leg was back down to normal. So there was something pressure going down the nerves and stuff, down into my leg. And so I know it worked.
Mike is now on the road to recovery.
So how have you been?
And the prognosis for others with similar conditions is looking positive as this field of medicine experiences an explosion of technology.
I think an explosion of technology really is the right word to use. Our predecessors who came before us in the 60s, 70s, and even into the 80s really had very limited options to do for patients in surgery. Nowadays, there's well over about 400 different options that can be done for the spine. When you total up the different techniques, the different options, the different devices, et cetera, we have a lot of options available to us.
Now, the O-arm sounds like a great advancement in medical technology. Is it standard, or is this sort of an innovative tool?
This is an amazing new tool, and you're really only going to find it at advanced spine centers like at Eden. This is not a common device. It offers an opportunity to almost look at the spine in 3D. It allows the surgeon to use images to line up the devices they're going to use for implants with much greater precision. And again, as you heard, a kind of an ongoing theme is smaller incisions, less tissue disruption. That allows the patient to get back to doing what they want to do much faster.
And this is more of a 3D combo X-ray meets MRI live technology, or is it
Star Wars? Yes.
meets Star Wars. Is it a surgical tool or is it a visual tool?
It's a visual tool. It's an imaging technique that normally a surgeon would have only available a flat image, 2 dimensions. This allows virtually a 3D image, and the surgeon can look at all angles of the spine as they're lining up how to do the surgery, and can take images at the end to make sure that what they've implanted, what they have fixed, is lined up perfectly.
So this goes on while you're actually doing a surgery, as opposed to an MRI, which happens before you go in and after.
Correct. This is happening on the spot. It's live images, and you can make sure everything is where it's supposed to be before the patient ever leaves the operating room.
So then a patient might ask, okay, is this going to make it longer, the surgery? Is it going to cost me more? How does this affect the surgery?
It won't cost any more. It may take a little bit longer to get that exact precision, but the reverse of that is, even though you may be in the operating room a little bit longer, your recovery time is far less. The old incisions, you'd be in the hospital for 7 to 10 days. It might take 3 months before you were back doing your normal activity. When you have the smaller incision, again, better precision with the surgery that you're having, in the hospital maybe 2 days, and probably about a month before you're back doing everything you want.
And again, that theme, faster recovery. Now stay with us. When we come back, we'll tell you how you can find out more about all of the things we talked about today on Your Health Matters.